Hello, I wanted to thank you for inviting me to be part of the King's Health Partners Annual Conference for 2022. My name is Paul Rothman. I just stepped down as the Dean and CEO of Johns Hopkins Medicine in the United States. I was in that role for 10 years. In addition, I am on the board of Merck and Company and King Faisal Health System in Saudi Arabia. I receive compensation for both of those. Don't think I'll talk about anything that has a conflict of interest, but I wanted to just make sure that you do that. So again, it's a privilege to be here and talk to you a little bit about where medicine is in 2022 and where it might be going in the future. I was told to talk about the good, the bad, and the ugly. Hopefully most of it's good, but some of it is clearly challenging. So as we come out of the pandemic in 2022, and as President Biden told us a couple of weeks ago, the pandemic is over. It's clear that academic medicine and medicine in general is going to be greatly affected by the greatest health crisis in our lifetime. To put it in perspective, as of Sunday on our website, we reported that there have been 621 million of COVID, and that's probably an underestimate. The death total, again, as of yesterday, was 6.5 million people have died. It has been a devastating and tremendous challenge to deal with SARS-CoV-2 and the COVID-19 pandemic. As we think about it, it clearly is going to affect medicine in the future. I think just some of the things that I take away from what happened during the pandemic, and some of which will influence us in the future. I always think as a leader of an academic health center, I think it really demonstrated how important academic medical centers are for the health of populations around the world. It really was, certainly here in the United States, and I think also in the UK, it was the academic health systems that helped lead the charge against COVID-19, helping to protect lives, find cures and preventative medicines throughout the pandemic. We really stepped up. It was not only the diagnostics early in the United States that we helped develop, but it was the vaccines, the antibodies, and the drugs. It was a lot of partnerships, as I'll talk about, but it really was the academic centers that talked about. And one of the amazing things about the pandemic was how academic health centers around the world communicated as they were learning from the pandemic. Early on, obviously in China, we heard somewhat, but it was somewhat muted from what we heard. But then when it hit Europe, certainly Italian health systems really told us of the devastation that they were. And then when it hit the US, it really was wonderful. And one of the great things for me during the pandemic was that Richard Trempeth and I got to talk on a regular basis and compare notes about what was happening in the US and the UK. It was very helpful for me to hear some of the challenges that you faced in the UK. But it wasn't just academic centers, it was industry and governments that really communicated in ways that we hadn't before. And it really was important in fighting the coronavirus. A third thing that I note out of the pandemic was it really demonstrated the dedication and sacrifice of healthcare workers around the world. People worked tirelessly in at times very challenging conditions, certainly early in the pandemic when we didn't have enough protective gear. It really was amazing to how our healthcare workers, nurses, phlebotomists, physicians, transportation people, everyone just stepped up and took care of people who were very sick. And I think there's no denying that they were the heroes of the pandemic. But we come out of it in looking at a healthcare workforce that is just tired, a little burned out. I think right now feeling a little underappreciated for all the hard work and efforts during the pandemic. And we come out, we see more health challenges coming along. We see, first of all, delayed preventative care that should have been done that will, I think, worsen our population's health in the future. And we have a population of people with prolonged symptoms from the virus, so-called long COVID, that we're going to have to deal with maybe for years to come. But the pandemic did test us in other ways. We had to demonstrate a nimbleness and flexibility that certainly for large systems like our own, I don't know how King's did, that we hadn't done before. And in terms of care models that had to be implemented quickly, we had to de-densify our hospitals, get the COVID patients in, get everything else out. We moved things out of the hospital. We adapted telemedicine in a way we didn't. We used to do 36 telemedicine visits a week at Hopkins. At the peak of the pandemic, we did 100,000 telemedicine visits each week. The numbers are staggering, and how we were very quick to be able to ensure we could care for our patients where they were and not in hospital settings, which at the time were felt to be too dangerous for people to come to. So those are things that I think will come out and stay as well. But there are other problems. We have a real problem, I think, with people questioning science, vaccines, the public health in a way that we don't quite understand, but we're going to have to deal with, because the anti-vaccine groups are very strong, and really anti-science groups are very strong here in the U.S. In the U.S., we also demonstrated that we had a failure to invest in our public health infrastructure, which had been true for decades, but it led to a very uncoordinated response here in the U.S. And it relied on really health centers like our own to step up and play that public health role, which we hadn't before. And finally, I think the lasting problem effect of the pandemic will be that it sped up changes that were occurring in our industry. That could be the adoption of technology quickly. It could be that we're going to have to move people out of hospital settings and into ambulatory settings. And I think we always knew we had a workforce challenge coming up as baby boomers retired from our healthcare workforce. But I think it's more than we anticipated. So what's the future state look like? Well, I think we do have a lot of pressures on us. We're going to have this workforce issue. So we have a tired, burnt out workforce. Physician burnout in the States is now over 60%, and as a Stanford study showed 2 weeks ago. We're going to have increased needs, as I said, both with long COVID and pent-up healthcare demand that we're going to have to deal with. I think certainly governments spent, a great deal of money, which they should have during the pandemic to ensure that our economy and our businesses were able to survive the pandemic. But those financial pressures will come home to roost. And certainly in the U.S. Government, the largest spend for the government is in our Medicare and Medicaid expenditures. So we're going to see that. And finally, the utilization of technology, which came to the front during the pandemic. I think that was coming, but I think we're going to see much more of it. The final other pressure that I think we have to deal with is healthcare disparities. So around the world, we had countries that with resources that dealt with the pandemic very well with vaccinations. And we've given 9 billion vaccines in this world already. I mean, it's an amazing and astounding number. But we had countries that could not afford it, and the pandemic was different in those countries. Within countries here in the U.S., we saw that the lower socioeconomic populations in this country bore the brunt of the pandemic, not only because they had more underlying diseases, which were true obesity and diabetes, but many of them had frontline jobs at the beginning of the pandemic that were needed, but exposed them to COVID. We're going to have to deal with these health disparities, which was something we were trying to do all along, but I think are going to be a larger challenge as we move forward. So I have 7 different things that I think are going to affect healthcare in the future. I think number one, we're going to need to use technology to make healthcare more efficient, more patient-centered, and to help improve the care for our patients. I think we demonstrated the pandemic, certainly some fields like psychiatry, we can see telemedicine still as a robust part of their practice. Some other areas I think have regressed in terms of telemedicine, but the ability to monitor patients outside the hospital setting is something that I think is important for their care. It could be hospital to home, which many of us have pioneered here in the States, where full hospital services are provided to people in the home setting, to just monitoring people in their home settings. The Internet of Things now allows us via things like this iWatch to monitor cardiac symptoms, blood sugars, blood pressure, many, many things that we're going to have to start to utilize this technology. And I think it's going to provide better care, but we're going to have to incorporate it into everyday medicine. I think this will help. I think if we do this right, we'll require a less workforce. It'll be better trained, but it may be able to take some of the burden away from us. I think care models are going to change. And finally, the use of artificial intelligence and machine learning is, I think, going to drive medicine in the years to come. And we already see it happening. And I think we're going to have to prepare for it. And it's going to increase. I mean, we can now know people are doing distal surgeries. And so I think the adaptation of technology is something that's really important. I think in the US, we have a very fragmented and invested public health system, which is going to have to be fixed. I think that you in the UK were a role model for what a public health infrastructure should look like, and we're way behind that. I think the partnerships between academic health centers and industry was essential in the pandemic. mRNA vaccines could not have happened if we didn't have partnerships between the researchers who developed stable mRNAs. The lipids that we use there were really generated in academia, and I think those partnerships are essential as we go forward. I think we have to be ready for the next pandemic, probably a coronavirus, and we already see people trying to develop universal coronavirus vaccines and medicines. One thing that we weren't prepared for, but we're going to have to learn how to better communicate with the public on issues of science and medicine. I think this disregard in some cases, but questioning of science, which was building up before the pandemic, is now going to come home to roost. And I think we're going to have to deal with it. And finally, if nothing else, I think that the pandemic demonstrates that long-term investment in academic medicine research is essential. If it wasn't for that vaccine would not have been out and approved within 12 months. We had therapeutics approved quickly. We had the ability to generate large-scale testing very quickly, saliva testing. It was just again and again that academics and the long-term investments have led to our ability to face this pandemic. In addition to what we've seen already, decreasing heart disease by 60 to 70% since the 1950s, now decreasing death from cancer up to 30% since 1990. And we're going to have to continue to we have demonstrated we'll have to continue to partner between industry and academic centers to help cure other health challenges besides viruses, things like neurodegenerative disease. So it really is all these partnerships, which I think, if nothing else, were demonstrated through the pandemic that were essential. So again, I think the pandemic's going to have long-term effects on healthcare. I think the drivers will be a need to be more efficient, a need to use a smaller workforce, and hopefully doing this utilizing the technology that is all around us. In addition, this will require long-term investments. It's sometimes in very basic science that I think in the long run have been proven to be essential for the health of the world. So again, I really want to thank you for inviting me to speak to you today. I want to thank Richard for his friendship and partnership during the pandemic, and I hope that the conference goes really well. Thank you.